I'm writing 2 separate plans with a lot of the same people, we're having a lot of success with bringing people together, new partners that really haven't spoken together in the past, to come together to work on this plan. Skipping a little bit, I think I'm a little behind, but you do have in your handout the list of the members of the consortium. It's a 2-page list. It might be a little bit hard to read the second page, but we brought together, I think, a pretty exciting combination of both local service providers as well as people working in a variety of different contexts statewide to write the plan. And what we're really realizing now as we move toward implementation is there's even a lot more people that we need to engage with, and we'll talk about that a little bit as the parts of the plan, but we are really excited about the opportunity to broaden the dialogue of who's talking about this and work together to create the change we're hoping to create.
All right. Yeah, so the current status of what's happening with the plan. Thanks, Deborah. And I had actually forgotten that I was going to talk about that. But the current status is that we have taken apart the timeline, the 5-year timeline, and we have a list of deliverables that we hope to accomplish in the first year of the plan's implementation. And out of that list of deliverables, we have organized 6 work groups, and those work groups include a communications work group, and they'll probably create a communications plan. We have a recommended practices work group, a data collection work group, resources for sustainability work group, a prevention resources work group, and a process and outcome evaluation work group. And we'll give you some more information about those things later. We have that in place, and we've been talking to people all over the state at different venues, including this one, about what we're doing and trying to get people excited and interested in helping us implement our work. And there was one other point. And this is really cool, that 100-page document, which is actually 110 pages, we have a 15-page executive summary of that we have been very generously supported by the Ohio Department of Health to have a graphic design created for. And so we're going to have a graphic design of that, and it's going to be printed. So we'll have a nice tangible, and we'll also be able to place this nice document on our website that anyone can read, because we really don't expect anybody to read a 110-page prevention plan. I mean, we knew that was crazy, but the CDC made us write it, right? So we did what we had to do, and now we're going to have something, a really nice deliverable that will be accessible for anyone in Ohio to take a look at, that we're really proud about. And I think it's going to be great as far as helping us to talk about the plan and to elicit some more excitement and participation in implementation.
So for the rest of our time while we're talking, we'll be telling you what the parts of the plan are. And we have basically 5 strategic areas that we're working in. And let me actually preface saying this by saying that we made reference to local programs, and we do have both Delta funds 3 local communities that are doing intimate partner violence prevention. At the Department of Health, we fund 20 local communities now that do local sexual violence prevention programs around the state. And the work that we're doing is both to be at the state level and also to support the work that they and others are doing locally. So as far as the first strategic direction, which we've been calling the Effective Youth, SV, and IPV, Sexual Violence and Intimate Partner Violence Prevention Recommended Practices, what we're trying to do in this area is look at what are the recommended practices that anyone doing sexual and intimate partner violence prevention work should incorporate into whatever curriculums they're using. We won't be mandating curriculums, we'll just be saying compare these recommended practices against what you're doing or thinking about doing to see whether you're meeting the best practice based on evidence and research to meet the goals that you're trying to accomplish. And then next to that will be an annotated bibliography of actual curriculum that you could choose to use that would have been screened through that recommended practice list. So it'll be a resource that anyone that wants to do this kind of work could go to, either to find a curriculum or to take a curriculum they might be thinking about using or already be using, and ensure that it's doing what it is that they hope to accomplish.
The second strategic direction is integrated intra-state collaboration. And we think the resulting products of that will be online resources related to sexual violence and intimate partner violence, primary prevention. And we really recognize the importance of collaboration across Ohio with various professional organizations and associations, and that they might not have sexual and intimate partner violence as their priority, but the degree to which we can help them think about that through providing CEU opportunities online and that kind of thing will help them understand and help them come on board with us in a better way. By providing online resources for professional education that's easily accessible. We're hoping to provide online policies, sample policies that would relate to sexual violence and intimate partner violence for adoption by those organizations and businesses and that across Ohio. That would also relate not only to sexual and intimate partner violence, but also sexual harassment. We recognize the need to work with legislators, that unless we have some interest in policy on that level, that we're not going to get so far, and that we want to help agencies and organizations better use media to adopt their advocacy strategies for working with the media, so that there's better work around that, and that the work that's done around the media, how often it is that sexual and intimate partner violence are not discussed in the media in a way that's relevant or useful for any of us. So we really want to impact that through these strategies.
We get to leveraging resources for maximizing sustainability, and so that's getting at the sustainability question that was really important to us as we did this work, was how is this going to become a permanent change? And leveraging resources, you might think initially of funding, and certainly funding is important. It's been very much on the headlines recently on the impact of changes in funding. And so one of the products that we're hoping to have come from this piece of our work would be more sustainability for funding for the work that we do. But we also have a lot of other things we're trying to put in place. One of the things we're looking for right now, and we're actually just in the process of getting out the paperwork for this, is asking people to sign on as partners in this work. So, if you all are from places that you're thinking, might have a role to play in supporting what we're trying to accomplish and having some relationship between our work and your work, we are asking for formal endorsement of the plan from people from a wide range of organizations in Ohio. We'll also be looking at ways that we can link what we do with other kinds of primary prevention efforts, both locally and statewide. And that was one reason why we really wanted to be here today, because we see a lot of the other kinds of programs that are represented during the conference as being programs that we want to be working in relationship with as we move forward with our work. We'd like to have a statewide directory that just connects anyone who's interested in doing the sexual violence and intimate partner primary prevention work, and have a communication plan so that people know what we're doing, as well as an education campaign. So just thinking about a lot of different ways to get the message out about what we're trying to do to different audiences around the state.
Okay. The fourth strategic direction is integrated strategic evaluation and data collection. And what we envision is a baseline online directory of SV and IPV primary prevention efforts in Ohio. So, we kind of know what's going on out there, but we don't know all of what's going on out there. But to really kind of categorize what's happening in an evaluation framework, we foresee an online directory of evaluation measures used here in